SCAI skylights, and will include the meeting as well as the society skylights. And I'm very happy to be presenting this to your audience as the president of SCAI 2023-2024. First of all, our meetings were at the Phoenix Convention Center mid-May this year. And first of all, let's start from some study highlights. SCAI has its own journal, the Journal of the Society of Cardiovascular Angiography and Interventions, and we have late-breaking trial sessions as well as featured clinical science and a very broad abstract sessions. We had a very interesting study of critical limb ischemia that was simultaneously published, as indicated, that included patients with revascularization after a best critical limb ischemia. The Clipper cohort, and you can see the outcomes that we had, 17% in 1-year mortality and 50% 5-year mortality. And this is the 1.1 million patients have this diagnosis, terrible diagnosis of rest pain or infection or tissue loss, plus a very abnormal lower extremity arterial testing. The mean age, 75, half of them female, 15% Black, 50% diabetes, 26% chronic kidney disease, and 50% has severe arterial disease by an accepted classification. Very, very interesting set of data. Coming to the coronary aspect, we had long coronary lesions treated with the Science SCAI 0.48, a new stent for the United States. I'm not sure it's available in your area. Perhaps it is already. We had about 100 subjects enrolled in 25 global sites. A reference diameter between 2.5 and 4.25, and a lesion length between 32 and 44, very long ones. Device success rate was 97%, and target lesion failure was 5.7%. Cardiac death and all MI at 1 year were just barely 5.8%, just essentially identical with the target lesion failure endpoint. Also, we had other studies, and I try to present one per category here. Pulmonary embolism, a real-world registry, the FLASH, in patients with patient population with 6-month follow-up. 800 patients enrolled in 50 United States sites, intermediate risk and high-risk patients. 75% completed the 6-month follow-up, and you can see the various clinical improvements of the LV-RV ratio, the RV function, the absence of dyspnea or just mild dyspnea, and a great improvement in the 6-minute walk with treatments of pulmonary embolism with percutaneous treatments. Very interesting if you see this set of data and this type of patients expanding the treatment options worldwide. So let's go to see now SCAI 2023 by the numbers. We had nearly 2,000 registrants, nearly 400 faculty, many attendees from outside, and faculty from outside the United States. 31 countries were represented, and for the first time had some learning labs, 6 hands-on learning labs, which was essentially in the exhibit hall, on the side of the exhibit hall, next to the abstract sessions, but they were sort of very interactive classrooms. You can review and see cases and talk with the experts, as well as talk with the technicians running the machines and the cases in order to enhance the imaging and enhance the lessons from the imaging. 11 late-breaking trials, as I told you before, 16 total live cases, 5 international live cases. That's very interesting for our meeting today. Many abstract presentations as well as case presentations, very rich conference as far as the exchange of ideas and discussion themes. We have tracks For many interests and all interests, coronary, peripheral, structural, congenital, the learning labs, as I explained before, some feature science, case sharing is very important, quality improvement management, and special sessions for women in innovation. We have many participating societies, and clearly GIS is among them. I'm very pleased to see that, and we hope to continue this collaboration in the future. At the same time, we have to talk about joining SCAI, which is the only international interventional cardiology society expanding from outside the United States all over. Invites physicians, scientists, and health professionals who are involved in the field of cardiac catheterization and angiography to become members regardless of their core specialty. That's a very unique feature of our society. Our first president was a radiologist, a well-known Dr. Melvin Judkins. I'm sure we're using some of your catheters in your cath labs all over. Now is a very good time to consider joining SCAI as an international member, because we have very many focused areas you could get engaged, either in the fellow training or participating in the fellows courses, or early career as well as mid and late career, SCAI faculty, emerging leaders programs, involvement in the SCAI committees, including the very active international committee, and obviously achieving the distinction of F-SCAI, which will be very, very important for anyone's curriculum vitae, including mine. We have nearing 5,000 members, and we have a tremendously high satisfaction from our members. Over 80% would unequivocally recommend SCAI to their colleagues. That's a tremendously high compared to the usual numbers we get from other societies. The benefits are many, and that's why I think people are satisfied. We have clearly educational materials such as e-learning libraries, many fellows courses, other live as well as on demand, SCAI scientific sessions, and we have many regional sessions and meetings such as this one, for example, in association with other organizations. We have many publications, particularly with our own journal, as well as we also have quality initiatives and clinical documents, often in association with other societies and international organizations. We participate actively in advocacy of interventional cardiology and for interventional cardiologists in the United States, and we offer worldwide networking and leadership opportunities. There's an app, My SCAI, to which you can communicate with each other and with anyone in SCAI and with myself and get updates. And clearly you can get involved in our committees and councils, etc., as you wish and as your time allows. And I do understand there may be some challenges with time differences with this part of the world, but we hope to overcome it through the participation online and exchange of ideas ahead or after the specific meetings. These are the membership categories, and as you see on the top right, the international associates, a tremendous pathway, a very, very, I would say, member-friendly to join and get involved. And on the left side, you can see the pathway from fellow in training to member and fellow of SCAI, all the way to member of SCAI, to master of SCAI, if after at least a decade or so, plus, I would say, of contributions. 2024, SCAI is going to be in Long Beach, California, right off Los Angeles International Airport, May 2 to 4. You can get a flavor of what the convention center is all about in the morning as well as in the evening. And we hope to see you, several of you, and many of you perhaps over there, and hopefully even more than last year. And not only see you, but also have your contributions in our scientific program with abstracts, case presentations, and perhaps involvement in some of our committees. It will be a perfect time to come and interact with our faculty and other associates of yours. Thank you so much for your attention, and congratulations, GIS 2023.